Hi there, Dr. Shelby here at Evolve Chiropractic in Woodstock to give you some tips and tricks utilizing a lacrosse ball. So I don't know about you guys, but oftentimes I will get a lot of pain in my glute region, and that's because as I bend over, I activate my glutes a lot, and that causes a lot of discomfort and tightness. So utilizing a lacrosse ball is the best way to get in there. So taking the lacrosse ball, I'm going to utilize this wall here, and I'm just going to put it right in the center of my glute, and I'm going to lean against the wall. Now, the first thing that I want you to remember with the glute is if you are standing on that leg, you are activating that muscle. So you can use your leg that you're working on, so in this case, my right leg, as a balancing, mechanism, but you want to be putting all your weight on your left leg because in that way you're not activating your right glute. So as I'm putting all my weight on my left leg, I'm utilizing my right leg to just keep balance, and then I'm going to be able to move the ball. So I'm going to move it side to side. I'm going to move it up and down. And the nice thing is with the glute, it is nice and big on most of us. And so what will happen is you can find a lot of different areas to work on. Now, you can roll it all the way out into the back part of where your hip bone is. So if you find where your hip bone, you can roll the ball all the way out there. You can roll it all the way along this SI joint right here, that triangle bone at the bottom of your spine. You can roll it right along there. You can roll it along the top part of your glute muscle, right at the top part of your hip bone there. All of those areas are fair game when rolling in the glute muscle. Now again, we don't want to be rolling on top of the bone, but right next to the bone is okay. Now as I'm doing my first 30 seconds here, I'm trying to find the areas that are going to cause me the most discomfort. Remember, with lacrosse ball, discomfort is okay, pain is not. So if you have to grit your teeth or you're starting to cry because it's so painful, you either need to back off pressure or stop completely so we're not doing damage to the tissue. So as I'm rolling, I'm taking the first 30 seconds to find that area, and it's about right there for me. So after I've done that, I can do a few different things. I can either sit and hold it, I can roll the ball around, so again, either side to side in that small area, I can roll it up and down, or I can start moving the muscle, right? Or moving the leg, I should say. So there's a few different ways to move the leg. First is what I call the windshield wiper with the toe, so you're turning the toe in and out. You can feel that muscle work under the ball. You can bring the knee up, kind of like you're trying to walk upstairs. You can kick the leg out and across, like this, or you can bring the leg up and back. So with the lacrosse ball, remember we're doing this for a minimum of 2 minutes, no more than 5 minutes in an area, ideally 2 to 3 times a day. Try this out and see what works.